For that generous introduction and also for having me here. I'm absolutely delighted. Nothing really fills me up more than being with the community. So for those of you I was able to meet already, I'm so happy to have connected, and I hope that I can connect with more of you after this. As Chris said, I am a movement disorders neurologist, but also board is certified in lifestyle medicine, and we'll talk a little bit more about why that is and why I sought that and what I hope to do with it. But broad picture, just as he said, the numbers of people living with Parkinson's is rapidly increasing. It's actually the fastest growing neurological disease. So not just neurodegenerative, like what we think about Alzheimer's and things like that, but neurological disease. And so we're very focused on how the numbers of people are growing and what we need to do about cures and prevention. But as we do that, how we can help people improve their lives with Parkinson's today. So that's a lot of what we'll be talking about. And I brought my colleague Danielle here, who's going to introduce herself. We hoped that it would be a little bit more engaging rather than me sitting behind a podium talking at you the entire time, that we would have a little bit more of a conversation. So I'll let Danielle introduce herself.
Hi everyone, it's so nice to see you all today. Thank you for having us here. Thank you for the introduction, Rachel, and bringing me along for this really fantastic opportunity. My name is Danielle Becta, and I have worked at the Michael J. Fox Foundation since 2019. And in my role, I travel throughout the country to meet with community members and folks who are looking for resources regarding Parkinson's and sharing information about research, what's happening, what's next, and just generating that type of interest. I do come to Texas quite a lot, so I am so happy to be here, and I'm happy to be a point of contact for anybody who has specific questions regarding our resources who lives here. So that's why I'm here today. Okay, so Rachel, let's jump right in. Why are we focusing on lifestyle medicine today?
So lifestyle medicine, and we'll talk a little bit more about exactly what that is, but it's essentially what I mentioned. It's helping improve life with Parkinson's today. So while our medicines are good, while our surgeries are good, there's a lot that we still have to address. And that's where lifestyle really comes in. And I always say these are tools that are at your fingertips. They're simple, even if they're not easy to implement, but they can be very powerful. And I think that's deceptive in the way they seem too easy and they seem too simple, but yet they can really have a powerful impact, especially when combined with medication and surgery. And this was really driven by you all, by people and families who are living with Parkinson's. So I've been at the foundation over 10 years now. And when I would go out and speak, I'd be talking about stem cells or the latest research. And there's always the question, what diet should I be eating? What exercise should I be doing, right? And I didn't have good answers. It was, a healthy, balanced diet, whatever that means, and, whatever exercise you'll do. And so it was really driven by hearing from the community that this is what you all want. You want actionable ways to take control and to positively influence your disease course. And so about 2-3 years ago, I think it was my pandemic project, I got a certification in lifestyle medicine. So I essentially went for an extra certification on top of the neurology and movement disorders to really add on that lifestyle component of it. And since having that extra certification, my goal has really been to bring lifestyle and Parkinson's together, not just for resources and tools that you can hopefully incorporate in your lives today, but also to push the research forward in this area.
That's amazing. And I love that you were able to pivot and see a need and decide to expand your learning so that you can share more with the community. Actually, before we flip to the next slide, I'd love to get to know the audience a little bit more. So if you are comfortable raising your hand, please raise your hand if you are currently living with Parkinson's, if you're comfortable sharing. And please raise your hand if you love somebody with Parkinson's, you came here with a friend. Okay, amazing. So everybody's invested in this conversation today. And I think regardless of your direct connection with Parkinson's or not, there are going to be some things that you could take away from today.
Yeah, and to underscore that, not just some things, everything. So, care partners, family members, you are the sometimes silent support team. But all of these things that we're talking about are just as important for you to be taking care of your health and your brain health in particular.
All right. So we have 6 categories that we're going to talk about today. I think we're going to find this a really great conversation. So let's talk a little bit more about lifestyle medicine and specifically how it can help Parkinson's.
Yeah, as I mentioned, you can see on the slide, I always say this is the stuff mom told us to do, right? Go outside and play and eat your broccoli and, get to bed early. It's all of those kind of foundational things. So it's really a back to basics approach. But what we're seeing, especially for heart disease, for diabetes, is that when we deliver these interventions, so we think of them as treatments, just like medication, just like surgery, if we categorize them that way and we think of them as important as those other tools that we have, when we deliver these in an intensive enough manner, we can reverse heart disease, we can reverse diabetes. So why wouldn't we be able to make an impact on Parkinson's? There's even early research to show that delivering these in the right manner and right intensity and combination could slow the progression of early Alzheimer's. So something we really don't have other great tools to do. So there's a lot of growing research in this area. Now it's hard to research, right? Because it's hard to control what somebody eats for a long period of time and also control for other things they might be doing that might be having a positive benefit. So that's part of why we see the research in its more early phases or not as rigorous, but we're seeing more and more data to show us that these are absolutely critical tools for Parkinson's, Alzheimer's, heart disease, diabetes. And as I said, for everybody who's aging, raise your hand if you're aging, right? So everybody who's getting older, which increases our risk for Parkinson's, for Alzheimer's, but then everybody who's living with Parkinson's or cares about somebody who's living with Parkinson's.
Fantastic. Okay. So we're going to jump right into our first pillar that we have right here. Let's start with exercise. Another audience participation point here. How many folks in this room currently have regular exercise in their day-to-day? I see very strong hands. Oh my gosh, amazing. You're doing better than I am. So congratulations. I need to practice what we're preaching. Okay. How many people use strength training as a part of their exercise routine? Amazing. Okay, good. Thank you so much. That was an important question for me to ask there. So let's jump into exercise, Rachel. What are some key things that we should be focusing on here?
So a couple of important points, and you see some of them listed out on the slide that I'll talk through. And I think that the big takeaway, which we'll get to at the end, is everybody knows we should exercise, right? I mean, that's not new information. So it's not about why should you exercise, it's how do you exercise. When life gets in the way, we're too busy, it's raining outside, Parkinson's symptoms are getting in the way, whether that's mood or apathy or tremor or movement changes. So it's really more about how do we think about those challenges and how do we work around them and how do we keep exercise a priority? What makes it meaningful for us? I think for a lot of people, myself included, it's good for me or I should do strength training because I'm getting older and my bone mass is decreasing. That just doesn't get me out the door on the days I'd rather stay home and watch TV, right? So it's really about examining why we want to do this, why this is important to us. So that, as I said, that's really the big takeaway from here. But if we back up and think about exercise in general, exercise is a type of physical activity. So physical activity is really anything we do throughout the day. It's, you walking into this room and you walking out of this room and you going, through the grocery store, any kind of movement that you're doing. Exercise, and that's good and that's important. And we should be doing that throughout the day. Exercise is a type of physical activity that has a pattern and a structure and a goal to it. So it's on top of physical activity. I'll say I was very disappointed to learn that a bout of exercise does not cancel out sitting all day because I will go do my run in the morning and then I'll sit at a desk for 12 hours and not get up at all. And that's just as bad for me as not having exercised. So it's really about both of those. How do we get in the regular physical activity, but also the regular exercise? And so that's kind of the biggest thing. As I said, the other next big question is, well, if I'm supposed to exercise for Parkinson's, tell me what exercise exactly, tell me what I should be doing. Exactly how much and which exercise and when. And the challenge is we don't have a solid answer for that right now. We don't have a personalized recommendation for Parkinson's. So we say the best exercise is a couple things. It's the one you're going to do. It's the one you feel safe doing. It's the one you enjoy. And it's the one you get the most intensity out of. So while there isn't a best exercise, you can box, you can rock climb, you can walk, you can swim, you can cycle. You can do whatever it is that you enjoy doing. But we want you to be doing it to a high enough intensity. So that's really where we're looking at your heart rate, or can you talk or sing during it? How are you measuring the intensity, and are you getting to the right level of intensity? So that's really where most of our research in Parkinson's has been, on this cardio and this aerobic, and seeing that when people are getting to that moderate to high intensity zone of exercise, at least 30 minutes, at least 5 times a week, then we're seeing that could potentially slow the progression of Parkinson's. So exercise is the only thing we have today that could slow Parkinson's. That's why it's so critical. Now, the other thing about exercise with Parkinson's is it's not just the cardio part. So that's why Danielle was asking about strength. A lot of us just think about exercise as cardio or as aerobic exercise, that exercise that gets your heart pumping. But in Parkinson's, and especially as we get older, there are other components we need to bring in. And strength is a big one of those. Now, it's important because as we age, as we live with Parkinson's, as women, as we go through menopause, our bone mass and our muscle mass decrease. So that's where strength is really critical. But now, if that's not enough for you, because you think, well, that's not going to happen to me, or I don't have to worry about that, it also boosts your memory and your thinking. So there have been studies to show that strength exercise in Parkinson's supports memory and thinking. So like I said at the beginning, maybe that's your motivation. So what is going to motivate you to get that strength training in twice a week? And it doesn't have to be bodybuilding, and it doesn't have to be your body weight. It can be exercise resistance bands. It can be different combinations of exercise that get in both strength and cardio. But it's thinking about those different components. So cardio, strength being the top ones, but then also thinking about our flexibility and our balance too. So there are different components of exercise. And I think I've covered most of the things I wanted to talk about here. But as I said, that last part is really, it's not just the why. I mean, again, I can tell you, we can talk the entire time about why it's so good for you. It increases chemicals that support brain cell growth. So we call it brain fertilizer. It decreases inflammation. It supports the connections between cells. It really helps your brain strengthen itself. It physically changes your brain just like it physically changes your muscles. But as I said, I can talk till I'm blue in the face about how good exercise is for you if you don't have a way that makes it important to you and that helps you bring it into your life, then you won't do it. So it's really about what makes exercise important to you. Is it that you want to be able to walk hand in hand with your spouse without feeling off balance? Is it that you want to go on that trip and the cobblestone streets are going to be wobbly and you want to be more balanced? Is it that you want to walk a 5K? So what is it that will make it important to you and get you out the door when life and Parkinson's invariably get in the way?
I think there's so many good points that you just hit on, and I can think of a dozen questions. But the one that's really boiling to the top for me, Rachel, is, how can we get started? This can feel really overwhelming. This can feel big, and there could be some physical limitations with more advanced stages of Parkinson's. So how can somebody get started with an exercise routine?
Physical therapists can be really helpful, of course. There are a lot of Parkinson's classes that can be a good introduction, but it's really about taking small steps. With everything that we're going to talk about today, nobody wants you to overhaul everything and say, okay, tomorrow I gotta start exercising, eating broccoli, I gotta join a support group, that's not gonna work, right? So it's about the small changes and the consistency and sticking with it and being honest with yourself. So we talk about intensity, for example. Well, we can measure intensity, but only you are going to be able to know, are you pushing yourself hard enough or are you pushing yourself too hard? For all of us, Parkinson's or not. So it's about kind of having that conversation with yourself, reflecting and adjusting over time and being honest. And some days you just need to take a break, right? We're all gonna have bad days, and then it's saying, today, the best workout is gonna be the one I don't do. Today I need to relax and take care of my mental health, but I'll get right back into it tomorrow.
I think that's really helpful. Rachel, if you haven't been on our website or don't follow her on social media, she has so many incredible resources that are out there. She's constantly updating, constantly getting things from the community about what they want to hear from. And one of the more recent guides that she helped publish was our exercise for brain health and for Parkinson's guide. And that is available on our website, michaeljfox.org/exercise guide. There are so many different kinds, and we'll talk about a few other as we go along, but just wanted to make sure you knew about that.
And that goes into much more depth on what is intensity, how do you measure it, what about different kinds of exercise, what does the research show, etc.
Yeah, absolutely. It's very comprehensive, and we have so much input from our patient community, so I think you'll relate to a lot of the content that's in there. All right, we are moving right along. Pillar 2. So, Rachel, you kind of teased this a little bit. Everybody's always asking me what's the best diet for Parkinson's, but let's back up a little bit. Why is diet and nutrition so important?
Yeah, I think this is a really important place to set the stage, and I think we can go to the next slide and just talking about there are so many areas of Parkinson's that can impact nutrition. So as I said, I think many of you probably know this and experience this, but I think it's an important way to just underscore why nutrition, why diet is so important in Parkinson's. So as you see on the slide, and I'm not going to go through that whole, all of the things that can impact, but symptoms, whether they're motor or non-motor. So if you have non-motor symptoms, smell loss is a big one for a lot of people. If we can't smell as well, we lose our taste, which might mean we lose our appetite, which might mean we lose weight. So smell loss is a big one. Mood changes, I know if I'm just feeling kind of down, or I'd much rather just eat a box of cookies than some cauliflower, right? So mood changes can impact our food choices or our lifestyle choices. And there are many other non-motors. Constipation, if we're feeling backed up or we're not hungry, our stomach's not empty, we get full early. This can all impact how much and what we're eating. And then motor symptoms are another one, of course. If you're having tremor, dyskinesia, that's physically just making it difficult to eat a meal, or if there's drooling or other swallowing changes Chris was talking about. All of those can impact, again, what you eat and what your dietary pattern is. Interestingly, the disease itself can also impact nutrition. So we see that people who are diagnosed with Parkinson's, even before they take medication, even before they live through the disease for a period of time, some of their vitamin levels are lower. So that's vitamin B12, which is really important for memory and thinking and for sensation, how well we feel the ground when we're walking around and how we keep our balance. And vitamin D, which, as we talked about with strength, is so important for bone health, for mood, for all kinds of things. So we see that those two vitamin levels can be lower in people with Parkinson's just from having the disease, as I said, without even medication. We also see that the disease might impact food choices. So for example, there have been studies that have shown that people with Parkinson's may have a different kind of diet. They may go for higher carbs. More sugar is a big one. Now I'll say I have a sweet tooth and I don't have Parkinson's, so I understand this one. But I think it's helpful to know when, if you're craving that sugar or you just feel like I gotta just kind of keep eating sugar, it may be that that's your brain saying I want more dopamine, because the dopamine is decreased in Parkinson's. So it may actually be the disease that's driving these things. Now, again, that doesn't mean it's easy to work around, but once we know, Yes. Oh, I thought maybe I was being cut off. But once we know those symptoms are there, we have an explanation for them. It's easier to then say, okay, how do we work around this? What substitutes for healthier sugars can we make? What can we look for that's going to satisfy that sweet tooth without a big piece of cake or something like that? And then the last thing is medications. So carbidopa-levodopa, the medication that everybody takes for Parkinson's at some point in their experience with Parkinson's, that can impact vitamin levels as well. So simply by how the medication is metabolized through our body, it can decrease some of the vitamin levels, B12, B6, and D. So when we see that, when we know that, we can monitor those. It's good to just make sure your vitamin levels are being checked and monitored, but also it's where our diet can fill in. We want to go to food first wherever we can before having to take a vitamin supplement. Sometimes we need the vitamin supplement, but it's where knowing that we can make sure that our diet is addressing those needs. And then the last thing I'll say on medication too, there's a class of medication that many people may be familiar with called dopamine agonists. So the brand names of these medications are things like Requip or Mirapex. And those medications can have some side effects that can impact behavior, but also eating. So there are some people who can have compulsive eating and like binge eating on these medications. So again, it's just very helpful, I think, to understand all of the different ways that Parkinson's can impact nutrition and how we can address those different ways through diet or through other management with our physician.
That's so interesting, Rachel. And as you were talking, about each of these pieces, everything kind of comes together. When you're eating and you're taking medication, is there some type of connection in terms of digestion or the gut that we need to be aware of when we're eating?
Yeah, and you see on the slide constipation, of course, a symptom that many people with Parkinson's live with. Sometimes that comes on even before Parkinson's, so decades before Parkinson's, constipation could be one of the first symptoms. And that can impact how we're eating, how our medication's working. The stomach can also empty irregularly in Parkinson's. So that can have a big impact too on how medication is moving through, but how food is moving through as well. And I think we were going to talk to you a little bit more about this gut-brain connection. Did we lose that slide? Oh yeah, there we go. So just to underscore this, so many people now are hearing about the gut-brain connection and the microbiome and so interested in how these connect to brain diseases like Parkinson's and like Alzheimer's. So the first big thing is, yes, our brain and our gut are in constant communication. So the brain is talking to the gut is talking back to the brain through nerves, through hormones, through chemicals that are released. The gut is actually called the second brain because there are so many nerve cells in it. So they're constantly talking to each other. And yeah, I always give the example, we can see this on a daily basis, right? If I'm feeling anxious or nervous about something, I have an upset stomach, right? It's not a coincidence. So my brain is going like, something's going on, and I'm feeling that in my stomach. And vice versa, we see that when the gut is affected, it can impact our brain health. In Parkinson's, several ways we see this manifesting. I already mentioned constipation, but Parkinson's really can impact the gut in many ways. Constipation is one of those symptoms, but nausea, stomach emptying problems, as I said. So lots of ways that we know Parkinson's is impacting the gut. We see those symptoms. Microbiome changes. So this is another thing that many people are interested in. We're seeing more and more research on. So the microbiome is all of the bacteria and other bugs that live in our gut. And we say they don't live rent-free. So they have a job to do. So they're digesting our food, they're helping our immune system, they're making vitamins. So they're doing all kinds of things for us. And we want to keep that relationship happy and healthy. We want to keep those bacteria healthy. In Parkinson's, in general, we see that this microbiome is different than in people who don't have Parkinson's. In general, it shifts toward more inflammation and less of the healthy bacteria that kind of keep the gut intact and prevent inflammation or things kind of leaking out through the gut. So we want to keep that microbiome, as I said, as healthy and happy as possible because we want to keep it working for us as well as possible. Now, as I said, the microbiome in Parkinson's we see is different in general than not in Parkinson's. But we have a lot of work to do to understand that better. We don't know if it's causing Parkinson's or if it's a consequence of Parkinson's. There are so many things that can impact our microbiome, including disease, but also medications, diet, where we live. So all of these things can really impact our microbiome and can change it on a pretty rapid basis. So we have a lot more work to do to understand exactly how the microbiome differs in Parkinson's and exactly how we might be able to intervene there to support Parkinson's. And then the last thing I'll say is, interestingly, we see that Parkinson's protein, which you may have heard of, there's a protein that we all have that's normal, but in Parkinson's, we see it clump up and fold abnormally, and we see that protein in the brains of people who are living with Parkinson's. In some people, we see that protein in the gut long before Parkinson's develops. So it may be that at least in a subset of people, Parkinson's is starting in the gut and traveling to the brain. So this is an area of really active research to understand exactly how Parkinson's is starting, coming on, and how it's progressing, because that could be a real area where we could intervene to potentially stop that progression and stop it from coming out as we know Parkinson's today.
I think that's a really hot topic, and I hear that question a lot when I'm out in the community. How does this happen? Where does it start? One thing that really stood out to me, Rachel, when you were talking about the microbiome was keeping it healthy. So is that something probiotics or prebiotics might be able to help? And is there any research there?
Yeah, this is always the natural next question. Well, if you tell me that, I have to keep my bacteria healthy, well, should I just take a probiotic? I've heard those are good for me. So the short answer is maybe. There have been some well, let me back up and say what probiotics are first. Probiotics are actual live, good, we think, bacteria. So we can get them through food, we can also get them through supplements, but essentially what we're trying to do is get that good bacteria into our guts and keep it there, make most of that bacteria good. There's something called prebiotics, which you may have heard of, which are food for the good bacteria. Mostly fiber, but it's what helps keep the good bacteria there and happy. So when we talk about probiotics in particular, there have been some studies that have shown probiotics could be helpful for Parkinson's constipation in particular. We don't yet know if they can help other symptoms of Parkinson's, but constipation particularly. Now the challenge with these studies is that they've all done it differently. So they've studied different types of bacteria in different combinations, in different doses, for different lengths of time. So that makes it very difficult for us to give a clear and consistent guideline on what exactly you should take if you want to take a probiotic supplement. So that's where, as I said before, we want to go to food first where we can. Probiotics, now this may not be your regular food choices of, kimchi and sauerkraut and, apple cider vinegar is another one, yogurt, but you can see you can get them from foods. Might be an interesting experiment to try to see if you like any of these or you want to, put them in any of your regular foods. But the other thing is we can get a lot of good prebiotics through our food and easily, because as I said, the main component of this is fiber. So if we're eating a diet full of fruits and vegetables, whole grains, beans, we're going to get more fiber. Most of us Parkinson's do not get enough fiber. In Parkinson's, we should be eating anywhere from 30 to 40 grams of fiber a day. Different for different people, for men versus women, but we should be eating more fiber than we are. So you can start kind of taking stock of what you eat, start looking at labels and seeing how much fiber you're getting as a baseline, and then you can kind of gradually increase that fiber there with fluid, because it only works with fluid. So making sure you're adding in that fiber, you're increasing it gradually, and you're adding enough water in there as well.
Well, thank you for kind of backing up a little bit. I know we want to get to that. What is the ultimate diet for Parkinson's? And I think, understanding the foundation and how you need to put those blocks together and having these different options to try are really important. So can you answer my question? What is the best diet? What should people be eating with Parkinson's?
So many people will probably know this, but the best research we have to date says Mediterranean diet for Parkinson's. or the Mind diet, which is very similar. It's a combination of the Mediterranean diet and a diet called the DASH diet. And Mind diet was really created to support cognition or memory and thinking in particular. So as I said, the most evidence we have to date, the best evidence we have to date, really supports either of these two diets for Parkinson's. Now, what I think is really important when talking about diet is thinking about the concepts. I don't want anybody to think, oh, I gotta eat, I didn't get my half a cup of blueberries in, and so I failed today. Or, it's really about what are the concepts and how can you then bring those into your life, no matter what symptoms you have, no matter where you like to eat and what you like to eat, what culture is important to you, what recipes are important to you, how you can then bring these concepts into your daily life. So these diets both are what we call plant forward or plant based. They really focus on vegetables, whole grains, beans, legumes as the foundation. They don't fully exclude meat, so you can eat meat on these diets. They just say make the plant part your foundation and then eat meat, fish on a little bit more of a limited basis. They also really focus on limiting things like sugar, as we talked about, processed foods, dairy, red meat, all of the things that are very common in our American standard diet. So thinking about what we want to focus on, whole foods as we see them in nature, and less of the boxes and the bags that are in the inside aisles of the grocery store. Using healthy fats is a big one, so olive oil instead of margarine or butter, avocado, nuts, all of these kinds of healthy fats that are really important for our brain as well. And then always a popular one is that red wine is okay, optionally, if that's something that you want to include.
I think that brings up a bigger question too. I mean, you have two diets that are kind of identified here, and I think you highlighted why these two are the ones that are elevated, and I think we see some different communities around the world that follow these diets more strictly or living longer, healthier lives. So I'm seeing a lot of parallels here. But we're talking about red wine. What about kind of like alcohol in general? Is there anything specific that we should be careful of with Parkinson's?
Yeah, this is a really controversial topic these days. I feel like we're seeing more and more in the news about this. And we've long heard that red wine is good for us, right? It's healthy for our heart and we should be including this. And now we're saying, well, I don't know. I'm not so sure. The Surgeon General just came out with a report that says alcohol is linked to many different cancers. And alcohol is essentially a toxin that we're putting into our body. Now, I will say, I'm full disclosure, I like a good glass of wine. So I'm not here preaching that you should cut out all alcohol. But I do think being more aware and informed. So we know that alcohol in too high of levels is harmful. I think the big question is there a safe level or is there a good level? And we don't have that answer yet. Now the guidelines will say no more than 2 drinks per day for men, no more than 1 drink per day for women. So we want to follow those guidelines at least, but I think just in general being more mindful about why we're drinking. Is it part of our social engagement? Is it part of our meals? We see, as you mentioned, a lot of these communities around the world that do enjoy a big meal with wine. Is it about drinking wine with food that something different about it? We don't know those answers yet. But I think being informed that there aren't significant, that we think of, aren't significant health benefits to wine that we couldn't get elsewhere from grapes or from other foods. And there are potential risks to alcohol, especially when we're living with Parkinson's, and even from just 1 drink. So who has problems with sleep? We're going to talk about sleep, right? But sleep is a big one. And I hate to tell you, but alcohol is not good for sleep. It makes us feel like we fall asleep faster, but it actually impacts the quality of our sleep and how well we sleep at night. So, there's sleep. There's also mood. Alcohol depresses our mood, and mood changes are a challenge for a lot of people. It can push us off balance even when we have 1 drink. So there's a lot to alcohol that we just want to consider and take into account and be mindful about so that we can make a decision for ourselves about what's best for us.
That's helpful to hear and to know that you can still enjoy a little bit of moderation, just be conscious of how it's kind of affecting you and what you need to do throughout your day. I'm looking at this food pyramid over here on the Mediterranean diet, Rachel, and I'm seeing, obviously a lot of great vegetable foundation, and I'm seeing that protein section. It's getting kind of smaller, and I want to recognize we're in Texas. There's a lot of good protein here in Texas. What is the interaction with protein? Is there something specific about medication or Parkinson's that we need to be careful of? I mean, I know it's important for us to eat protein, but what does that really mean in terms of these diets?
Yeah, and protein is critical. We do not want to exclude protein. We all need protein, especially again as we age, as we live with Parkinson's, which can impact our muscle mass. I think one of the interesting themes that we see a lot is that we equate animal protein or animal meat with protein. And that's true. Animal meat, chicken, steak, fish, it does have a lot of protein. But there are places, beans, chickpeas, etc., that we can also get a lot of protein. So I'll say, I don't eat meat and somehow I get enough protein, right? So there's a lot of misconceptions around can you get enough protein or do you only get protein from animal sources? So that's kind of the one thing to know about. And again, to not be put off by these diets because they do allow meat and they do include these different sources. So you can still follow these diets and still eat your steak once a week or whatever it is that's important to you. That's why I don't want people to feel too restricted by them because it's really about where can you make the healthy changes. But to answer your question about protein and medication, dietary proteins, so we're talking about fish, steak, chicken, beans, quinoa, some of the whole grains. Dietary protein can interfere with levodopa, that medication that most people with Parkinson's take. And the reason it can interfere with it is because they're both absorbed in the same part of the gut. So if you take your medicine at the same time as you eat a lot of protein, it just might be harder for that levodopa to get in and get absorbed into the bloodstream and work. Now, for a lot of people, this isn't a problem or it isn't noticeable. But as Parkinson's progresses, it may become more of an issue. And we see this particularly if you say, my medication just isn't lasting as long as it used to, or I take doses and they just don't kick in, or unpredictably, it just seems like it stops working. So if you start to see those challenges where medication isn't working as well as it used to, then this is an easy place to start looking. And just to say, is there some kind of interaction that's happening for me? Again, not with everybody, but in some people it can be a bigger issue, and there may be ways around it, which is why we want to look at it. So the first thing to do is just keep a log for a couple of days. You don't have to do this forever, but just notice when you're eating and when you're taking medication to see. Yeah, now I notice a pattern. If I do eat and take my medicine, it doesn't last as long, or whatever it is. Or no, I don't notice any difference there. But keeping that log, if you can, depending on how often you take medication and when you take it, if you can schedule it before your meals. So when your stomach's empty, it's going to have the best chance of getting into the gut and getting absorbed. If you take it very frequently, taking it after a meal, if you can spread it out enough, that's a little bit less ideal just because you've got stuff in your stomach that's got to work its way through. Depending on what you eat, it might take longer, etc. So if you can do it before a meal, that's ideal. And then if you have to eat it with a meal, which life, like sometimes we just have to take medicine with a meal, then maybe just noticing how much protein you're getting in that meal. If you can just kind of limit the, not eat a big steak or just limit how much protein you're eating at that time. And then the last thing to say is there is a diet which you wouldn't want to do on your own. You would always want to do in conjunction with your doctor and with a nutritionist or dietitian if that's available to you. But there is a diet that has been shown to help in people who have really significant interactions with protein called the protein redistribution diet. And essentially what this is doing is redistributing your protein toward the end of the day. So it's very important to still get that recommended dose of protein. For most people, that's like 0.8 grams per kilogram or 1 gram per kilogram. You still want to be getting enough protein during the day, but you're eating a little bit of it just during breakfast and lunch, and you're saving the vast majority of it for dinner. So that you have more protein, you're still getting all your protein, but if there is an interaction, it's still impactful, of course, but it's maybe less impactful than during the day when you need to be up and moving around and exercising, etc.
I think that makes a lot of sense, but thinking about some of the recent medicine approvals, I mean, most people take their levodopa orally, but there are some alternatives now. Do you think some of these new medications might be helpful in kind of leaving the digestive system out of this and the protein processing?
Yeah, as we said, one of the big challenges is that the digestive system is impacted in Parkinson's. So whether that's swallowing or the stomach or the gut with constipation, there are many ways along that track that can impact absorption of medication and digestion of food. And in the last couple of months, we saw multiple approvals, but two of them are new formulations of medication. So they're existing medications that have been reformulated into a liquid form so that they can be infused continuously under the skin like an insulin pump. So these are given all day, every day, so that we hopefully keep a consistent level of medication and it bypasses the gut. So you don't have to worry about swallowing a pill and whatever else is going on in the digestive system, but you're getting that medication directly into your bloodstream so that it can work more effectively and more smoothly and consistently.
That's really exciting to see that. There's so many options now. If you want to learn a bit more about diet and Parkinson's, surprise, we have another guide. So I'll just say here that this is very, very comprehensive. There's even some recipes in there from our staff and community members on how to find some alternatives. You'll see one in that picture up there. It's one of our office managers, actually, which is wonderful. So this is real people who are providing practical input. And really, again, another comprehensive guide. I think it's really easy to follow, and there's a lot of options in there for you to check out. So these are all free, and you can download them on our website. Anything else about the diet guide, or?
No, I think the only thing I'd say, which you can find in here, and again, many of you may experience already, is that diet can also be a tool to help us work around symptoms. So not only can it help us with easing symptoms, lots of fiber can maybe help with constipation. Eating more fruits and vegetables and less processed foods might help support mood and cognition better. But also when we have those changes, when we have swallowing problems, or when we have smell loss, there's a lot we can look at and do with diet to help us kind of work around those symptoms. And there's more in the guide about that.
Awesome, thank you. Moving into pillar number 3. We talked about some exercise, we talked about diet. I think those things typically bring social connections. I love going out to eat with my friends, but you have this as a whole pillar, social connection with Parkinson's. And I would love to hear more about how this is good for our brains, how being a part of community might help improve the experience of somebody living with Parkinson's. So can you just share a little bit more about that connection?
Yeah, the takeaway here is that loneliness is bad for our brains, right? With or without Parkinson's. And loneliness is essentially a feeling of being disconnected. So you could be in this huge room with 100 other people and you could still feel lonely. You can be happily married and you can still feel lonely. So it's about understanding what loneliness is, knowing that it's not good for our brains, it's not good for our cognition, our memory and thinking, it's not good for our mood. And knowing that there are many things about Parkinson's that can cause us to feel lonely. People with Parkinson's report feeling lonelier than people without. And there are lots of reasons for that. It may be that symptoms are getting in the way of you connecting with other people. Voice changes, we've talked about that a little bit, can make it difficult to be heard or to connect with people. Just kind of slowing down with our processing might make it harder to keep up in a conversation with multiple people or in a loud place. So there are many ways that people with Parkinson's can feel isolated and lonely, and there are many ways that care partners can feel lonely too. So it's important to understand it, and it's important to do something about it, because as I said, back to the Surgeon General, there was a report that the Surgeon General said loneliness is as bad for us as smoking 15 cigarettes a day. So, that just kind of puts it in context for you about how bad loneliness can truly be for us.
I think about, as we get older, it can be harder to make friends or maintain connections. People move away, or local community systems may change based on where you are in your life. So I mean, and some people aren't just outgoing and don't want to go out and meet new friends all the time. And, I can be kind of introverted when I'm not up on stage here with you. So I understand that there can be a lot of challenges with that. So what can we do to try and push ourselves to make sure that we're having the right types of social connection and that are making us feel included in the Parkinson's community?
So just to say, the main point here is we talked about how bad loneliness is for us. Social connection is really the antidote to loneliness. And when we talk about social connection, that can be a little confusing because you can say, well, I have, 100 friends on Facebook. I know a lot of people, but it's really about meaningful, positive relationships that you're giving to and you're getting from. So social connection, as I said, is the antidote to loneliness. It also boosts our resilience to stress. It boosts our mood. It boosts our cognition because we're interacting with other people. So that's why social connection itself is such an important piece of the puzzle. When it comes to social connection, I mentioned a little bit of this. Community or being around other people, being in a relationship, whether it's a marriage or a partnership or a close friendship. There are different areas of connection. And that's where I said, you could be happily married and still feel lonely because maybe you don't have a lot of close friends outside of that, or I shouldn't say a lot, but maybe you don't have close friends outside of that, or maybe you don't have community that means something to you. So it's important to kind of look across our existing relationships and where we have connection and where we might feel we're missing connection. Now, the important thing about this is, as it says on the slide, it's quality over quantity. So you don't have to go out and go to a big party or go up on stage or whatever it is. It's about connecting one-on-one in a way that's meaningful to you. It's also about, as I said, these different kinds of areas of connection. There's an example up on the slide of something called social mapping, and you don't have to go through this, but I think it's a nice way to make it more practical in the sense you might say, well, I'm not sure if I'm connected, or I'm not sure if I feel lonely. Well, this gives you a tool to look at across, what kinds of relationships do I have? Do I have a close friend I can go to? Do I have a community that's important to me? Whether that's the Parkinson's community, whether it's volunteering for something that's important to you, whether it's a faith-based group, having that community. And again, it's having those positive, meaningful relationships. But I think a lot of this as well is about having purpose and having that bigger meaning in life.
Yeah, and what I'm hearing is those in-person communications and connections are definitely really important. And everybody being here today, a lot of you came with somebody. So if you don't feel like you have a lot of those connections, somebody showed up with you here today already, so you're doing a great job. But I love all those examples of the different ways to kind of find that community. And a lot of things people are probably already doing, they just might not realize it. So it's not as big of a challenge as I thought it was. So I hope that was helpful for folks. One thing I will say that even though in person is probably the best way to connect with folks, there is a virtual community out there. Here's one of the options that we have. It's called the Buddy Network, and it is a virtual community for somebody who is either living with Parkinson's or if you love somebody with Parkinson's, which is everybody in this room here. And there's different areas where you can kind of plug in if you're interested in exercise or if there's very specific questions that you have that maybe you don't want to ask your doctor, or maybe you don't feel comfortable talking to your spouse about, but you just kind of want to crowdsource some information. So this is a great way to build community, but I know a lot of your local support groups also offer virtual options as well. So please don't be afraid to look at those. Those could be just as meaningful. Sometimes maybe if you're under the weather and you can't get out in public, but you still want that connection, just know that there's something online that you can do, whether it be nationally or locally. So just want to kind of remind folks of that.
Yeah, and there's so much, through this tool or whatever works best for you, of seeing that other people are having similar experiences. There's so much in that, again, Parkinson's or not, that really helps us feel seen and heard and less alone. So when you're able to share your experience or somebody else shares theirs with you, that's a powerful place of connection. And we find that through the Buddy Network, but of course in your local exercise classes or support groups.
Well, another way that I think about building community is getting involved in research. Surprise, we're a big research organization and we want folks to participate in research. So there's a couple of things that are on the slide here. The first being the Parkinson's Progressions Markers Initiative, or PPMI for short. This is an incredible study where we learn about living life with Parkinson's and biological aspects of that. So folks can either participate in person or online. Again, more options there. It's kind of a choose your own adventure. I feel like once you put in your information, it selects what track you should be on. So if you're ever interested in participating in clinical trial research, that's one option that we talk about. But on the other part of the slide, you have Fox Trial Finder. And this is kind of like a match.com for clinical trials. And it pulls from government websites. So it's not just things that we are sponsoring or we have funded, it's everything. So I did a quick search before I came here, and within about 25 miles of here, there's 17 clinical trials, and that is both online and in person that folks can participate in. And it is a variety of different clinical trials. I think there was even one using postural stability on a Segway, one of those scooters that you take on tours. So there's some really cool research happening locally here. So I encourage you to check that out if that's something that you're interested in. There's a lot of different types of research out there. So don't be afraid of participating, and you can always opt out if you're in a study and you say, you know what, maybe this is crossing a line that I'm not comfortable with, but definitely take a look at it. We need people living with Parkinson's and folks, their loved ones. We need you all to participate to make this successful.
Yeah, and it's not, it is participating and connecting with a community, but it's also connecting to something bigger, right? I mean, for so many people with Parkinson's, they say, we have innumerable examples of people who say, maybe depending on where I am with my disease, I don't think this research is going to help me, but it's going to help everybody else who lives with Parkinson's or will eventually live with Parkinson's. So it's really about that. We're always so impressed with how altruistic the community is and how generous, but so many people say this is a place where I'm connected to something bigger than me.
All right, we are going to move into this next topic, and I'm really interested to hear more about this. So what about stress, Rachel? We talked about so many different things with diet and exercise, and those can be ways that can either contribute to stress or maybe help with stress. But Parkinson's and life with Parkinson's can be stressful in general. There's a lot of things that you have to consider about your day-to-day life. So at the very most basic level, how can stress be harmful to our lives, especially with Parkinson's?
Yeah, it was making me think as you were talking, like we can get stressed out about not doing enough exercise, right? Or not eating the right diet, and those can be sources of stress for us too. But stress obviously is such a prevalent part of our lives. Parkinson's are not, and I think it's kind of like social connection. It's something we just don't pay enough attention to. We don't talk enough about. There are some stats that say that stress is related to 70% of diseases in some way, shape, or form. But yet, when's the last time your doctor asked you, how's your stress level? How are you feeling? Probably not a whole lot. So it's something that is important for us to recognize and pay more attention to, and to think about as part of our Parkinson's treatment regimen. Simply put, stress is like loneliness. It's bad for our bodies and our brains. Stress is hard to define because we all feel it so differently, and we feel it for different reasons and in different ways. But we default to feeling stress as a mental concern or a worry, right? But really, stress is a physical response. In your body, we have a cartoony slide, it's not my favorite, but the idea is just to show you that stress is causing changes in your body. Your body is preparing for that fight or flight, to flee the situation or to fight the situation. So your body's increasing your blood pressure and raising your heart rate and slowing your digestion, which we know is not great in Parkinson's, right? It's doing all of these things to prepare you. And I think of this too in a way to bring it to our daily lives because, right, this is a response that was built in so that we could flee from a lion or whatever, cheetah, whatever it was that was chasing us, right? Like in the many hundreds of thousands of years ago. So we don't exactly have to do that today, but maybe we do need to get out of the way of a car that's coming toward us, or we do need to meet a deadline. Or we are stressed out by a conversation that we're having. I think about this as a good example of fight or flight. Say you're in an argument with somebody. Do you either want to just shut the conversation down and just not continue? Or do you want to flee from the conversation and say, like, I just can't talk about this anymore, right? So this fight or flight, I think we see in many ways in our day-to-day, but we don't think about it as a stress response or that our body is actually having this response. Now, some stress is good, right? I mentioned, you might need to meet a deadline at work, or you might need to get out of the way of a car that's coming toward you, or whatever it is. There is a good reason for stress. Our bodies do have this for a good reason. The challenge and the problem comes in when this stress response continues in the background at a low level all the time. And that's where most of us operate. We have this stress that's kind of going on in the background that maybe flares up from time to time, or we don't really pay as much attention to it. So all of these changes are continuing to happen in our bodies without us even realizing that. And that over time can impact cognition. It can impact mood and be linked to anxiety or depression. It can decrease our immune system. So it has these true and real physical changes that really impact our bodies and our brains.
So the $1,000,000 question is, what do we do about stress? How do we handle it?
Yeah, this is a tough one, right? But I think the first thing is acknowledging it and not judging it. Right? We all have stress, and it's okay. It doesn't make you a weak person because you get stressed out about something that maybe somebody else doesn't. It's part of our lives, and it's okay. But we have to acknowledge it and recognize it. The second thing is learning about what stresses us out. As I said, what stresses me out is going to be different than what stresses Danielle out. But is it, for me, it's maybe getting 1,000,000 emails in a row that I just can't get to, or it's having to manage finances if that's just not my strength, or it's going out to an event when I have Parkinson's and I'm worried about if I'm going to get there on time, or if my medicine's going to wear off, or whatever it is. So it's about recognizing, learning about yourself and knowing what triggers your stress. And then on top of that, how your stress shows up for you. So is it that physically you notice your shoulders scrunch up by your ears, or your hands tense up, or your palms get sweaty, or you can feel your heart racing? Or is it that you get irritable and short with other people? Or something else happens? How does that stress show up for you, and how does it come out for you? And then the last thing is try different tools. So the thing about stress is that there are so many different ways that we can manage it. So it's not just meditation, which we'll talk about, but there are many different ways that we can manage stress. And it could be really just taking a deep breath in that moment. It could be journaling, taking a bath, praying, coloring, whatever it is that just gets you kind of calm in that moment, or gets you out of that, it sort of resets or decreases that stress that's happening. And as I said, there are so many different ways. It's really, you can think about it, have fun with it and experiment with different ones, because what works for you is going to be different than what works for somebody else. But the other thing is that what works in one moment might not work in another. So I'll say, if I'm stressed out by my boss, I can't say, I gotta go take a bath, sorry, So what is it in that moment that I can do? Is it that I can just take a deep breath, or I can rub my fingers together so I'm feeling the fingertips and I'm bringing myself just back into this moment, and that's calming me down. But it's what different tools do we have so that we've got a whole toolkit, and we've got different things that we know will work at different moments and for different triggers.
So you teased a little bit about meditation. What about meditation and mindfulness as a whole? I feel like there's a lot of different stigmas around meditation, especially folks who haven't started to try and use that tool.
I like talking about this because I think it is one of those things where you say, well, I'm stressed out and you're telling me to just take a deep breath. You have no idea what this is actually like. Or you're telling me I have to meditate. Do I have to go to a silent retreat or sit on a cushion in the dark and not think about anything for 30 minutes? And that's not what meditation is. Meditation is a form of mindfulness. And mindfulness is all of those things we just talked about. It's whatever activity. You can be mindful while you're sitting in this room. You can be mindful while you're washing the dishes or while you're walking the dog. It's being in the present moment by incorporating what you're feeling, seeing, and hearing. So it's really grounding yourself in the moment. When we can bring ourselves in the moment, right, we're not thinking ahead and worried and anxious about the future. We're not thinking about the past and depressed or sad about what happened. We're just here right now. And so that's part of what mindfulness is. And you can, as I said, you can be mindful in so many ways and with so many activities. I love it as a tool because you don't need to have any extra equipment. And you can do it anywhere, anytime. So that's where mindfulness can be so helpful. And then the thing on the deep breath, I think is very interesting because, right, like, I mean, somebody tells me to take a deep breath when I'm stressed out. I mean, that's a whole different story. But it's true that taking a deep breath is physically helpful because when we have this response going on in our body and we're in the fight or flight, taking a deep breath actually calms your nervous system. And it tells your nervous system, okay, pump the brakes. We don't need to be stressed out. And it pushes us, this is our fight or flight, pushes us to the opposite extreme, which is what we call rest and digest. And so it resets, it allows us to calm down, and it allows our brain and our body to kind of heal themselves.
I think that awareness piece really stood out to me. I know a lot of times if I'm feeling stressed, there's tightness in my jaw or my shoulders. And if somebody just, if I'm scrolling through Instagram or something and I pass a video and it's like, pause, release your jaw. And I'm like, oh my gosh, yeah, I was supposed to be relaxing, but I was not relaxed with what I was doing. So just paying attention to those physical things, it really helps when you're being mindful. So the next area here, this is something that actually stresses me out, Rachel, is not getting enough sleep. I feel like my schedule is all over the place. And I know from speaking with a lot of people in the community that sleep with Parkinson's is less than ideal. I saw a couple of hands go up before that they do have difficulty sleeping. So anybody feeling brave, I want to say, like, you're having trouble sleeping with Parkinson's or without? Yeah? No? Wow, we have a lot of good sleepers in this room. Okay, well, I'm going to be coming to you
Share
for
all your
advice later.
secrets. Yeah, we'll bring you up on stage.
Yeah, please. Oh my gosh, wow. I could have used that last night. But let's jump into sleep, Rachel.
Sleep is, this is why we started with acknowledging sleep can be such a challenge for so many people with Parkinson's. So I want to preface this by saying, I'm not under the illusion that telling you to move more throughout the day is going to solve all your sleep problems. But I think there are things we can think about in our day that may help support better sleep. Now, we're starting here by just showing that there are many ways that Parkinson's can impact sleep. So it can be just on the circuitry itself in the brain and different cells that are impacted that are causing changes as part of Parkinson's that impact sleep and circadian rhythm. It can be symptoms, so motor symptoms making it difficult to fall asleep, or you wake up and you can't turn over in bed, or there's a lot of stiffness. It can be non-motor symptoms, feeling anxious, and that keeps you up at night, or that wakes you up at night, or that wakes you up too early. So there are many parts of Parkinson's on the motor and the non-motor symptoms that can interfere with sleep. There are also medication side effects. So some medicines might keep you more awake, some might make you more sleepy. And so those, of course, can also impact how you feel and how well you sleep. And then I'm not seeing the other one. Is there one more component of?
Yeah, we can jump over there. How
No,
to
it's just
use
thinking
it.
of that,
Sorry.
there's one other aspect of Parkinson's I'm forgetting off the top of my head. Oh, yes, there are other sleep disorders that can be part of Parkinson's. So insomnia itself can be part of Parkinson's. There's a condition called REM sleep behavior disorder, where you act out your dreams while you're sleeping. That can be part of Parkinson's. So the point being on here that there are many ways that Parkinson's can impact sleep.
So going back to kind of the core of the messaging here, what are some lifestyle changes, lifestyle medicine approaches that we can use to get better sleep?
So like I said, this is not to diminish that sleep challenges with Parkinson's are a very real thing, but it's also to say there may be some tweaks and things that you can do throughout your day that might help invite better sleep. But we're going to say invite on purpose, because you can send out the invitation and you can ask that sleep to come. It just might not. And that's not okay, but you've done your best. There's really nothing you can do outside of that. Some sleep specialists will say a good night's sleep starts the moment you wake up in the morning. So it's really about how are you moving throughout the day. We talked about the importance of regular activity. Are you getting up once an hour and walking around your desk or walking around the block? Are you getting the right exposure to light? So when you wake up in the morning, are you opening the windows or are you going for a walk in order to get that light that stimulates that awakeness? On the opposite side, as daylight decreases, are you decreasing your light inside? Are you decreasing your screens? Are you getting ready? Are you mimicking that natural exposure to light? What you eat and when can have a real big impact on your sleep. So things, of course, like caffeine too late in the day, or drinking a lot of water. Now, drinking water is very important in Parkinson's, but if you're drinking too much water too close to bedtime, are you having to get up to use the restroom a lot throughout the night? Also, are you eating in ways that may be interfering with your sleep? Are you eating too close to bedtime? Are you eating too big of meals or too spicy of meals or things that are hard to digest that are interfering with your sleep? So the point being, there are a lot of little things that we can look at throughout our day to see if, could we make some small tweaks here that might help optimize sleep. The other thing is, have a bedtime routine. I mean, like, who has had a bedtime routine since you were 9 years old, right? But we have a morning routine. We get up, we make our coffee, we take our medicine, we need to have the same thing at bedtime. We need to get our bodies and our brains in the habit of expecting sleep. So whether that's you turn your screens off at a certain time or an hour before bed, you take a bath or you start reading a book or you do something that relaxes you, that gets your body and brain prepped for that night of sleep, and it just gets you in that habit and it gets your brain ready to expect sleep.
All right, I'm going to try and take some of these tips away from this section. I think that's my key takeaway here. Go for it.
My wife had Parkinson's for 45 years, and she's not mobile anymore. She's in a wheelchair, recliner. But one of the things I haven't heard to mention, music is really important.
So the question is music, and how is that important with Parkinson's or just life in general? Music's a big center to who I am. That's what I call my therapy. So can you talk on that?
I love the question, and keeping us on our toes here. So music is so important for so many reasons, and in Parkinson's, in Alzheimer's too, and anything, there's so much emotion tied to music, right? You can remember what you were doing or why a song is important to you, and it's a place we can connect. So if somebody I'll share, my grandmother had Alzheimer's, and it was hard for us to, have a detailed conversation toward the end of her life, but we really connected over music. I knew she loved like that big band and, hymns and Christian music was very important to her. And so we would turn on that music and we just listen to it together. And that was our way of connecting with each other. And it was also, it brought up those emotions and memories for her. So it can be a very powerful way to connect. And then practically, for people who are still mobile with Parkinson's, but maybe have challenges with walking and balance, music can be a really powerful tool at helping keep regular rhythm with walking. So this is something that oftentimes there are such professionals as something called a music therapist. They aren't widely available, but there are music therapists who are specially trained in using music as a part of therapy, just like there's speech therapy or physical therapy. But sometimes music therapists or physical therapists will incorporate music as part of a treatment tool to help you get a better rhythm of walking. So, sometimes they'll use metronomes, but sometimes it'll be the beat of the music that they'll say, okay, we want you to step in rhythm with this music, and that will help with some of the walking problems that can happen with Parkinson's. And then the last thing, I'll say two more things. Music is like a very powerful tool. So one thing is, who feels better when they put on a good, upbeat song and that gets you motivated and gets, right? So music can really have this too. Like I need to pump myself up for going up on stage, and I have my, song that really gets me motivated. But also it can be a good voice treatment as well. So, speaking voice is lower in Parkinson's, and I've had some speech therapists who say, okay, before you get ready to go to that big party, put on a song you love and just sing at the top of your lungs, whether it's in your house or in the car on the way there. And it's it's an exercise for your vocal cords. So music can be very powerful.
Thank you.
We wake up all kinds of hours. And so we go into where the TV is. and turned it on, and I guess it was about 4 in the morning. And she's sitting there watching this PBS, and right down the clear, she said, Jeremiah, I love the bull. Where'd that come from? We now have a little deal that sits in the window where she sleeps. And you can tell it to play rock and roll or whatever.
I love that. Yeah, it's just something that brings us all together and unlocks those really special moments in our life. And I love that you brought, thank you for that. And we should have a few moments, I will say, I did say this before, but for a couple of extra questions at the end. So if you have questions, don't hesitate on that. But thank you, that was perfectly timed here. Well, Rachel, one more area that we wanted to focus on is avoidance of harmful substances. We talked a little bit about alcohol and diet and things like that, but there are so many other things out there that we need to be aware of. And so what are some harmful substances that we can see in Parkinson's?
When we talk about harmful substances or just exposures in general, we're really talking about our environment. So everything that's outside of our genes. And if you move to the next slide, this gives a good overview of how environment can both positively and negatively influence Parkinson's. And it has on here Parkinson's risk, but it's also living with Parkinson's. So a lot of these we know can negatively impact the experience of Parkinson's. And as I said, both good and bad. So we've talked about some of the good ways we can influence both risk and progression of disease through managing stress, eating a good diet, exercising. But then some of the things that we think about that are connected to Parkinson's in a harmful way are things like pesticides, chemicals, like something called TCU, which is in a lot of dry cleaning that's in our water. Air pollution is another one that's coming up more. You've probably heard about microplastics. That's another area that's really starting to show more and more research. So it's all of these things that are in our environment that can impact our bodies and our brains in a potentially negative way.
And I know it might be hard to see for some folks, but there's some red arrows and blue arrows. The blues are supposed to be a positive association, and the reds are that negative association. But I see a blue arrow with cigarettes. Can you talk a little bit more about that? Because I don't know if cigarettes are good for anybody.
So we would not recommend anybody start smoking to decrease their Parkinson's risk, but it's a very interesting environmental link that we learned a long time ago. So by looking at big populations of people and seeing who smokes cigarettes versus who doesn't, those who smoked cigarettes seem to have a lower rate of Parkinson's diagnosis. So it was this, what we call inverse association. Doesn't mean that the cigarette smoke is actually causing that decreased risk, but there's something there. There's some kind of association. And this is really how research starts, is getting curious and going, well, what is it about cigarettes that might be helpful in Parkinson's? Is that people who smoke cigarettes, they're outside more, so they're getting more exposure to light? Is it that they are walking more? Or is it something in the cigarettes? So we looked at nicotine and actually did a study to see could nicotine slow progression of Parkinson's, and it didn't. So now we're saying, which I think is very interesting, is it actually lower oxygen or carbon monoxide, which whoever thinks carbon monoxide is good for them, right? We have detectors in our homes because we know it's not good for us, it's harmful. But could we give low doses of carbon monoxide, or could we intermittently decrease oxygen to help Parkinson's? And there are actually studies ongoing right now to look at low oxygen or hypoxia and to look at carbon monoxide in a pill form to see if it could help with Parkinson's.
Okay, that makes a little bit more sense, because right next to exercise, I was like, I don't know about that. You were talking a little bit about those environmental risks. Can you kind of expand upon actionable things? So I think a lot of times with environmental risks, they're like, well, I'm just walking around. There's nothing I can do about the air quality that I'm walking in, or things that are just outside of my control. If somebody's using a certain chemical for my dry cleaning, what can folks do?
I think this is a place where, as you said, it can feel really deflating to go, so I live in New York City and I like to run outside and I always think like, is the air pollution canceling out any benefit I might be getting from, or is like running next to the road, is that canceling out any positive I might be getting from exercise? And, we don't really know. We're doing the best we can. But as I said, this can feel really deflating to say, what can I actually do when there's all these things in our environment? And I think it's small things. It's getting informed. I'll say when I started learning about these things, I did start learning about air quality and just looking on my phone, the Apple phone has an air quality measure on the weather app. So you can see that every day and see, is the air quality a little bit worse today? Maybe I should exercise inside, or maybe I should wear a mask, or maybe I should keep my windows closed. So it's just kind of learning more and taking steps where you can. And I think there are a lot of little steps we can take to help us feel more empowered.
Well, that definitely leads so nicely into this next slide right here. Just give me 1 second and then I'll come over to you, all right, love? So when we think about what we care about and how we can kind of take action with things that are kind of bigger outside of our control, is there anybody in this room who's ever reached out to their elected official for something they care about? Yeah? That's wonderful. Well, you can do that with Parkinson's related things as well. We have really been on the forefront of looking at things like pesticides and how we can kind of limit those in the environment. And there's a lot of other ways that you can advocate for what you need here in Texas and for the overall Parkinson's community as well. So that's just a quick plug there if you're interested in getting more involved with advocacy around Parkinson's. So I did see a hand.
And now, the previous
Oh.
slide, could you elaborate on dairy consumption?
Oh, dairy consumption.
I knew that one was going to slip by. Yes, that's good for catching it. So dairy is a complicated one. You saw when we talked about the mind and the Mediterranean diet that we want to kind of limit those kinds of things, limit our cheese. In Parkinson's research, we see kind of conflicting data. We see in some ways that more dairy could be linked to an increased risk of Parkinson's. There's also some research showing that when they look at people reporting their symptoms and how their disease progresses, those who eat more dairy seem to have more significant Parkinson's symptoms. So maybe it could contribute to progression. So the bottom line is the data is a little bit conflicting, but there may be something there that dairy could contribute to Parkinson's risk as well as to Parkinson's progression. We don't know exactly why that might be. I mean, there are many possible answers. Could it be that there are pesticides in the dairy? Could it be that it's impacting different disease pathways? Could it be that it's impacting our microbiome in negative ways? But I think it's kind of like we talked about with alcohol or like we talked about these other things. It's knowing that there might be something there and then doing what's best for you. For some people, that's, they feel better when they don't eat dairy regardless. For others, it's limiting dairy. So probably best at this point, knowing there's conflicting data, to limit it, if not take it out if that's consistent with your eating pattern.
Just another consideration. Again, it was in those food pyramids, but do what feels right for you. That's a great question. Thank you. So we covered a lot today. One thing I want to recognize is that can be really overwhelming, especially if you're new to this or you feel like you have a lot of steps to go to get yourself in a good space where you're living your best life with Parkinson's. And so, Rachel, how can people start making these lifestyle shifts to focus on a better life with Parkinson's?
So I think, as you said, it's a lot we threw at you, and maybe go to the next slide, but it's these are all behavior changes, which are challenging, right? I mean, most of us are in our midlife or later, and we're pretty established in our habit. I'll say I am. I'm pretty established in my routine and my habits. So when you talk about building new habits, we have to maybe unlearn old ones that aren't as good for us. And it's about building new ones, which takes time. And so the biggest thing, I think, the biggest takeaway is make small steps and be consistent. It's that consistency that's more important, because that's what's sustainable over time. There's a lot too that we can talk about with, positive reframing and things like that, but there's a lot to be said about that and thinking through, I can add, I don't know what sounds good to you, like, broccoli, right? That doesn't sound that great, but like I get to add something versus I have to take away. You know, I drink more water versus I drink less soda. You know, that kind of thing. And just thinking through and kind of tricking your brain into thinking this is a really fun thing we're doing, we're getting more out of this. But also things like, you know, telling yourself, I'm a daily exerciser, or it's a kind of fake it till you make it. You know, there's a reason these are regular and permeating pieces of advice because they work. And so there's really, you know, as I said, it's knowing that we're building new habits, but it's also kind of setting yourself up for the most success. And I think probably the biggest one is where we talked about reflect and then giving yourself grace and compassion. So those kind of last two on the slide. So what is it you want to get out of this? You know, we talked about this with exercise, but just in general, why do you want to make a change? And what is it that's going to make that meaningful to you and make you stick with it?
Well, one thing that helps me start to process things after I've been in a situation where I'm learning a lot of good information is to kind of think about what our next step is. And before we move into additional questions, I just want you to take a moment and think to yourself, what is one thing you want to take away from today that you want to try and include or increase in your life? So you can think about it silently, or you can share it with the person that you joined, but we'll just give you a minute or two to do that. But take one actionable step that you can take away from today. So just think about it.
I have a question. The question I have is simple. Should I read or should I hear audible?
We can definitely circle back to that question. Should you be reading or listening to audiobooks? Happy to circle back to that. Thank you. All right, do we all think about it? Everybody has their one thing? Okay, we're chomping at the bit. We are moving into our question space. I love it. Let me just make sure. We just have briefly wanted to share some additional resources here. Dr. Dolhun is just such a rock star when it comes to all of these different materials that we have available. She has her Ask the MD series. We have webinars, podcasts, and we also have numerous guides. So I also want to reinforce that if there's something you don't see on our website, or maybe a different option that you think might be additive to something that is currently on there, please reach out to us. Rachel takes all that feedback to heart, and she's constantly reviewing these guides to make sure that they're meeting all the needs and expectations of our community members. So if you want to learn more, again, those are on our website. Anything you want to highlight there really quickly?
No, I think we just pointed to a couple of resources, but as you saw, there are other ways to get involved too. If you feel like you're good on education, you know, there's policy, there's research, there's buddy network, there's, you know, a whole host of ways. So if you go to our website, you will find many more resources and also opportunities to get involved if that's of interest.
Okay, amazing. So we'll move into our Q&A section here. So the first question that we have here, Rachel, is it better to read a book or listen to audiobooks?
I guess it depends. So I'm a person, I love reading too. So great for, you know, reading is very good. I mean, that's one of my stress relievers is reading, kind of being in my book. I'll lose time when I'm in a good book. But for me, listening does not work because I start thinking about something else and I have to read the same or listen to the same page, I should say, over and over. And it takes me forever to get through an audiobook. So, so for me, I prefer to read an actual book. But if there are reasons that that's not as comfortable, maybe your eyesight isn't as good, or maybe holding a book just isn't comfortable, or maybe, you know, you prefer to listen while you're walking outside and get your exercise in while you're doing something else good for your brain and kind of multitask that way. So it really, you know, one isn't necessarily better than the other, but it's just about knowing which one works better for you.
So many options. All right, I see one hand there and one here. I know we have a microphone somewhere, so let's see. Gentleman back there with a gray sweatshirt.
Thank you so very much, first and foremost. I have two questions. The first one is, can you talk about GLP-1s and symptomatic treatment? I know about the one study that didn't prove fruitful, but are they looking at the other GLP-1s and or SGLT2s? And then the second question I have is, I'm a veteran and have been exposed to PCBs. Yeah, it's actually in my medical file, but the VA is not acknowledging that as a etiology of my disease. And I didn't know if you had any information, advice, guidance, etc.
Thank you so much for being here and thank you for the questions. So first on GLP-1, so these are the drugs we hear about now. Everybody, it's on every commercial, I feel like, and every, semaglutide or Ozempic and Wegovy, and these medications that are kind of all the rage now, right? And it seems like, not only are they for weight loss and diabetes, which is what they're originally created for, but now we're hearing so much more that maybe they could be helpful for Parkinson's, for Alzheimer's, for addiction, for all kinds of things. They're kind of the miracle drug, it seems like. Interestingly, these drugs have been under study in Parkinson's for quite some time, as you mentioned. And you might wonder, why would a diabetes drug help in Parkinson's? Well, we talked about all the ways that the gut is impacted in Parkinson's, but these receptors that it works on, they're called GLP-1 because they work on a receptor called GLP-1. Those are throughout the brain as well. So it's actually working on the brain. Our brains use sugar or insulin at an increased rate, and so are we also optimizing how the brain is using insulin and how it's getting its fuel source. And then maybe could these drugs decrease inflammation, which is part of Parkinson's as well. So there's a lot of reason to believe that they could offer benefit in Parkinson's. As you said, the largest study in a phase 3 study of a drug called exenatide just reported out recently, and unfortunately was not positive. So this was studying the drug in people who had Parkinson's to see if it could slow progression, and the researchers did not see that. But as we often see in Parkinson's and other, complex conditions, is there are other drugs under study that show that maybe there is a positive benefit. So there was another one called lixazanitide, another type of GLP-1 drug that reported out earlier in the year and said, well, maybe there is at least a slight positive benefit in people with Parkinson's who are taking it. So the short answer is the drugs are definitely under study. There's reason to believe they could work in potentially slowing the disease, but the data right now is conflicting. Now, just because one of those studies failed doesn't mean the class as a whole is dead, for lack of a better term. It's still very much under active study. And the question really is there a better type of the drug that's maybe getting into the brain better or working better, particularly for Parkinson's, because of course we need the drug to get into the brain to work? And or are there subsets of people who really might benefit from this? We always talk about how Parkinson's is so different from person to person, and we see that from the symptoms. We're trying to learn more and actively working on learning more about what inside the body makes it different. Is it that one person has more inflammation and another one has more GLP-1 impact or whatever it is? And so is there a subset of people, maybe people who have diabetes or people who have insulin insensitivity or whatever else it is, who might benefit most from these drugs? So a very interesting and very active place of study, and for Alzheimer's as well. And then your question on being a veteran, thank you for your service. Yeah, thank you. So your question on being a veteran is, we do see that veterans do have an increased risk of Parkinson's, and that could be for a variety of reasons. You mentioned the exposures to chemicals. Agent Orange, of course, is a big one, but also repetitive head trauma we know is linked to Parkinson's. We saw that on our environmental slide. So there are a lot of things about being a veteran and the occupational exposures of being a veteran that could be linked to the increased risk of Parkinson's. Around PCBs in general, I'm not sure that there's any active work, but our advocacy team would definitely be there, definitely always working on these kinds of links, and also increased funding from the DoD for more research on Parkinson's, particularly in the veteran population. As an example, I'll say our policy team worked on making sure the links for like burn pits, for example, were more recognized and connected. So there are things like this, and we maybe might need to just bring back your feedback and let them know that if they're not working on it already, that's a place for them to be working.
Thank you so much. So I'll have a question in the front over here.
Thank you. We hear a lot about the plant-based diets, and I would like to know, is there research comparing people who are vegetarians with people who are on a regular diet? Is the incidence of Parkinson's lower among them? For instance, I'm thinking of the Seven Adventists or other countries that are certain cultures that forbid you eating beef, for instance. Is the incidence really lower of Parkinson's?
Thank you, that's a great question. So is the incidence of Parkinson's lower in vegetarians essentially versus those who are not? I'm not sure that itself has been studied. Now, when we look at Seventh-day Adventists is a good example because that actually has been studied, and they do see lower rates of heart disease and diabetes and things like that for certain. But as far as a vegetarian diet and Parkinson's and whether that decreases risk, I'm not sure that has been studied. When we do look at these diets, like the Mediterranean, there definitely is when we look at observational studies to see what kinds of diets people are eating and do they go on to develop Parkinson's, we do see lower rates with Mediterranean and with MIND. And we also see that even in those who do eventually develop Parkinson's, that the onset of the disease is delayed. So there was one study actually, I think it was in Sweden, but of women who followed the Mediterranean diet, and the closer they adhered to the diet, the longer their time was to Parkinson's, and some of them were delayed by almost 2 decades. So if you think about, what kind of quality of life you're getting and before being diagnosed, that's really huge.
Amazing. Question in the back.
First of all, thank you for all that you do personally, Rachel, and to your foundation for all the work you do on helping those of us with Parkinson's. Traveling to Texas on Saturday is above and beyond the call. My question for you is 2 parts, and I've already forgotten the first part, which was, what is the most exciting studies that your foundation is invested in? First of all, short term, and second of all, long term.
Do you want to start?
Yeah,
I'm talking, so
I'm happy to give you a little break there. When I think about what the clinical trial pipeline looks like and what's happening with Parkinson's, I see that now more than ever, we have so many clinical trials that are actually looking at how we can adjust the disease and how we can either slow down the progress. I know the future is stopping, reversing, but there are so many clinical trials. I believe there's about 150 that we're actively keeping an eye on right now. And most of those are clinical trials that are focusing on how we can change the course of the disease itself. So that's encouraging to me, knowing that these studies are happening. And not only are they happening at a higher success rate. We're seeing a lot of studies in phases 2 and 3 and even 4 that are working on this problem here. And I think, when I'm thinking about like certain specific areas of research, I'm probably most excited about the things that we can tangibly see biologically. So that would, for me, link back to our recent biomarker discovery from a couple of years ago, where you can see a protein in the body, the protein Rachel was talking about earlier, alpha-synuclein clumping together in most folks who have Parkinson's. And there are several clinical trials that are at advanced stages right now that are focusing on that particular protein and how to stop it from clumping together or how to unclump them. Or really just kind of prevent it from happening altogether. So I think the puzzle pieces are starting to come together, and I'll start there and let you take it away.
Yeah, thanks for the whole break. And thank you for the question. I think, how I always put this in context for myself is I left practice to come to the foundation 10 years ago, and the treatment options and the research pipeline look extremely different. So, in the last 10 years, we've seen something like 21 new treatment approvals for Parkinson's. And as you mentioned, we have, 100, 200 trials that are testing drugs or treatments, I should say, to better treat symptoms and or slow the disease progression. And that also looks completely different. So, we've seen over a decade this huge shift in our available tools and our, upcoming tools. And I think we're really primed and we're seeing this, that in the next couple of years, we're going to see this continued really increased momentum of research development and breakthrough. So just in the last year, less than a year, we had 4 new treatments that were approved for Parkinson's. So 2 of those infusions I mentioned, a new medication, and then a new deep brain stimulation surgery system. And that was just in the last year. And then now that we have this, we call it a biomarker. It's really just a test for disease. But now that we have this test, we're really hopeful that this can help speed the research in the sense that we can make sure if we're able to test, do you have that Parkinson's protein? Then we'll know more quickly and more clearly that if we're testing a medication against that protein and it doesn't work, well, okay, that's because it didn't work, not because we have to question, did we not have people who had that protein in the trial? So we always talk about this as getting the right people in the right trials. I mean, also as we optimize that tool, which is a huge focus of work right now, is getting that tool. Right now it's a spinal fluid test, which is not exciting for a lot of people for, understandable reasons, but moving that test into a blood test or to a nasal swab or something like that. So making it more accessible, but also making it quantifiable. Right now it's a yes/no test, which is helpful, but we need to get more clear data on it. What's the level of it and is it changing? And once we're able to see, is it changing, we'll have a clearer, more objective measure of if and how our treatments are working, which right now is like when you go to the doctor's test. This is how we're testing it in research too. Is that better? And that's why we have to follow people for so long and research takes so long because we have to see over time how that's changing. So with the current momentum, with these new tools, I think we're really primed to see it even faster momentum.
You'll be happy to know that in Texas, we even do clinical trials on Parkinson's on horseback.
I love that. I see some hands in the back over here. Reach to the plaid button down, and then we'll come to the front over here.
Oh, thank you. Is axillary connected to Parkinson? And if it is, can it cause damages?
Can you repeat that one more time, please?
No.
Is achalasia connected with Parkinson's swallowing? The lack of achalasia, it's like the bottom of the stomach, the esophagus, where the opening is closed and it won't go down. Has that been linked to Parkinson's or is that separate?
Yeah, I not to my knowledge, but certainly as we talked about, so much of the gut and the GI tract can be linked to Parkinson's. I mean, we certainly do see swallowing changes, of course, as we talked about, swallowing problems. And it raises another important point too, is that I think our tendency, especially if we've lived with Parkinson's for a long time, is to kind of link everything to Parkinson's or blame everything on Parkinson's. And while Parkinson's certainly can cause a lot, and there are a lot of other diseases that are linked to Parkinson's, there are other things that can happen outside of Parkinson's too, right? So it's just, not defaulting to blaming everything on Parkinson's all the time.
Well, you said when we saw somebody, they said that's not related to Parkinson's, but he's had esophagus damage for years because he throws up all the while and choke. So could that throwing up and choking cause damage to the esophagus? That is the question. Can that do that? So leading to the other one.
Yeah, it certainly sounds like it could. Yeah.
Thank you. Right over here.
Just quickly, Dr. Rachel, I heard you say something earlier about rims.
Yeah.
Is that just a Parkinson's symptoms? Because I jump in my sleep, so now I'm thinking like, what's going on?
Uh-oh, yeah, no, I'm just kidding. Yeah, no, it's, so thank you for the question and thank you for the opportunity to talk a little bit more about this. So REM sleep behavior disorder, or RBD, is a sleep condition. And essentially what this is where we act out our dreams while we're sleeping. So normally, the normal process is that our bodies, our muscles are actually paralyzed so that we can't get up and run across the room or throw a lamp or do whatever to act out our dreams. So it keeps us safe and in our beds. In Parkinson's, or in REM sleep behavior disorder, the circuitry gets impacted. And so people's muscles aren't paralyzed and they can act out their dreams. So a lot of times this looks like yelling, not just a little bit of jumping or not just a little bit of talking, but like yelling, screaming, shouting, thrashing about in bed, jumping out of bed sometimes, grabbing things from the nightstand. Care partner spouses are often impacted because, they're just kind of going to the next person and kicking or even grabbing the person who's in bed with them, not realizing it, of course. And interestingly, the dreams with REM sleep behavior disorder are often very active. So they're about sports. People will say, I was dreaming I was, throwing the touchdown pass in the game, or they're being chased by somebody, or they're chasing someone. So that's why they're so active. A couple of things that are very interesting about this. Now, one is that REM sleep behavior disorder has in some people been shown to be one of the earliest signs of Parkinson's. So long before movement symptoms or anything else, people will say, I started acting out my dreams. And there are studies that show that a significant percentage of people who have that REM sleep behavior disorder will go on to, over time, develop Parkinson's or something similar to Parkinson's. Not everybody, but a significant portion. So this is a very interesting piece where if we can follow and study people who have REM sleep behavior disorder, we can really see how Parkinson's is coming on from its very earliest moments and where we can intervene to stop it from progressing and becoming Parkinson's as we know it today. The other thing is a lot of people with Parkinson's do develop this symptom. So sometimes it's very early and long before the Parkinson's diagnosis. Sometimes it's after you've been diagnosed with Parkinson's and then you develop this symptom. If you do have Parkinson's and have this symptom, people will ask what will happen over time. For some people, it stays about the same. For some people, it gets a little bit worse. And for some people, it actually gets a little bit better. But it's really about treating it as well as we can. There are some medications that work to treat the symptoms of it. Melatonin, which is an over-the-counter supplement, and then also a medication called clonazepam, because we really want to decrease those symptoms, not only to help with better sleep, but also to keep the person and their spouse or bed partner safe. And then the last thing I'll say, because you started by saying, you jump in your sleep and I'm a little bit concerned about this, there are so many other things that can impact our sleep. So while, of course you hear this and you jump to thinking that that's what's going on, there's some normal movement with sleep. And if it's something that's of concern, your doctor can send you to a sleep doctor who would be the person to see. And then what we do, how we actually diagnose REM sleep behavior disorder and other sleep disorders is to have you sleep in a lab overnight, and it sounds really comfortable, right? Like nobody sleeps well and gets a good night's sleep, but we have you sleep overnight in a lab and we monitor your brain waves and your movement and all those kinds of things so we can see exactly what's happening. Is it REM sleep behavior disorder, or is it something else, or is it, a whole lot of nothing, which hopefully it is.
A couple questions over in this section. We have blue and white top normally here.
I don't need a microphone. You mentioned stress management and that the general population could bring their level of stress to the attention of their doctor during an appointment because most doctors, that's not their first question. Do you have a scale or a screen that you recommend for healthcare providers? I'm an occupational therapist and this is my tribe that I can deploy in my assessments and then communicate with the physician.
Oh my gosh, I love the question. And I don't have a good answer for it right now, but I will dig into it and I'll see if there's a scale or something and we'll connect afterward because, I love this is also, so we talked about, the community being so generous, but healthcare providers and, other supporters of the Parkinson's community are so invested. So I love that you're here to get more information and you're looking for ways to help with this as well. But, yeah, we'll connect afterward and I'll see. I don't know if there's an easy to use scale, but I will definitely dig into it and see what we can find. And if not, we'll come up with one together maybe.
Beautiful, sign me up. Can I ask one more question? You mentioned the absorption of the protein competing with levodopa and to create a log. I encourage bladder logs and how many times you're going to the restroom in the middle of the night. Do you on the website have a log for that very purpose yet? Is it in the diet guide?
No, you're pointing out our deficiencies here. No, it's good. And I think it's just because, it's a good point because I think we think of it as so simple, like just keep a piece of paper and a little, it doesn't have to be overwrought and things, but you're right, it's a good note of things that we can at least point out of things to track. And I mean, your point as well, I always talk about logs being, it's not something you have to keep all day, every day for the rest of your life, but it just, if you can look at it for a couple of days, it gives us a nice pattern. So definitely something to think about, and thank you for the feedback.
Thank you.
Does somebody have a microphone already?
So is the iPSC cells, are they still something that they're looking at?
Stem cells, right? Yeah, thank you, because I wanted to mention this and I forgot, so I appreciate you all being my memory here. Stem cells is a huge area of interest and opportunity in Parkinson's, and we hear a lot about stem cells being very promising or being, an area of hope for Parkinson's. But the research has understandably taken some time. What we're looking at in stem cells is we're really trying to figure out what's the right kind of cell to give and what dose and how will it help. So we can now create dopamine cells in the lab, so we don't have to worry about embryonic stem cells or umbilical cord or anything like that. They can create them in the lab. And if we give those stem cells, the way that many of the studies have been looking at these is actually implanting the stem cells into the brain, into areas of movement where they would need to work. And why it's taken some time is because we need to see, do those cells build healthy connections and sustain themselves? And if so, how do they help? Most of the studies are looking at seeing if these stem cells could help with the symptoms of Parkinson's. So they're not as much a curative therapy or even a slowing the progression, but they're more on, could this be a different way to treat symptoms on a more consistent and long-term basis? But excitingly, a trial is now moving to phase 3. So the last stage of clinical trial testing on stem cells. So to see if, could we implant stem cells in the brain in people who have middle to moderate stages or beyond of Parkinson's, and could we impact their symptoms? And so it is moving forward. We're of course very cautious about this and needing to answer a lot of questions, but in the interim, I always take the opportunity when talking about stem cells to just mention, there are of course a lot of stem cell clinics out there that are promoting unproven therapies, and this is very different than the way that we're studying stem cells in Parkinson's. So those clinics that are offering for you to come in for tens of thousands of dollars or things like that, they're really not proven therapies, and they're not the same as what we're looking at in the research studies for Parkinson's.
Okay, we'll go.
I told Michael about 10 years ago, when they were discussing stem cells and the expense, I said, if you get it to grow hair, our linebackers, the expense will go away.
I think you're onto something there. If you can show that there's a lot of potential in other areas, like with stem cells, more people might be interested in it for sure. So growing hair is probably number one.
Hi, thank you for being here.
I really have a question about like the lifestyle modifications or any specific things to consider with people with deep brain stimulators that are getting treated for Parkinson's.
Yeah, it's a good question. So how does having deep brain stimulation impact lifestyle? I mean, I think everything is largely the same. You know, just like all of these lifestyle factors can help your medication work better, the medication and the surgery can help you implement the lifestyle factors better. So exercise is a big one there that, you know, I always tell people, think about medication when Parkinson's impacts what you want or need to do. And a need is exercise, because we know it's so important for Parkinson's. So if you get to the point where Parkinson's is impacting exercise, taking medication can help you exercise to the level you need to. On the flip side, exercise can actually boost your dopamine and, you know, help your medication work better because it's giving it a little bit more of a boost. But in general, no, I don't think there's anything that's especially different for if you have deep brain stimulation around these things. Of course, there are some things you think about with exercise and, you know, repetitive movements with having the machinery in place and being careful to not be, you know, hit directly over it. Swimming is one you might have heard about in the news. There's some people who say after getting deep brain stimulation, they weren't able to swim as well. We're not sure exactly, you know, if that's a widespread phenomenon or things like that, but it's, you know, it's interesting to understand how deep brain stimulation may impact these areas.
I know we were speaking with somebody earlier this week who loves to play pickleball and they're worried about their swing and everything. So it was, you know, I think the main point you made was just try not to get hit with the machinery, with the ball there. But yeah, those repetitive movements. But I mean, it sounds like you can do so much still, and there's really not a change there, which is great. Back there in the orange. Oh wait, do we have a microphone somewhere else? Sorry. You're all are doing great with the microphones, by the way. Thank you so much.
To further add to the question about the deep brain stimulation, how do you know if you really need it? Because in talking to my doctor, she said, well, you might be a good candidate, but it seemed very dramatic for me because I wasn't at a point where I think I really would need it. So how do you determine when it would benefit you the most?
Thank you, and I realize I should take the chance to just talk just high level about deep brain stimulation to make sure everybody knows what we're talking about. So deep brain stimulation is a surgical treatment for Parkinson's, and it treats the symptoms of Parkinson's just like medications do. So it doesn't slow the progression, it doesn't impact the underlying disease. Deep brain stimulation requires a surgical procedure to put wires in the brain into areas that impact movement. And then those wires are connected to a battery pack or a programmer that we program with specific settings unique to you to decrease those symptoms. So those settings send small electrical impulses up through those wires into the brain to decrease the movement symptoms. So deep brain stimulation primarily works for movement symptoms, so tremor, slowness, stiffness, dyskinesia, or, you know, that's an extra movement that sometimes people get with Parkinson's, or what we call motor fluctuations, so wearing off of medication over the day. The way that it's talked about a lot in general is deep brain stimulation can be most beneficial in two situations. One is when you have tremor that doesn't respond to medication, and the second is when you have these movement symptoms that medication helps, but it causes side effects or doesn't help enough. So again, you take medicine and it seems to decrease your symptoms, but you have to take medicine every 2 hours, and you're kind of up and down all day, every day, because the medicine's coming in and helping, and then it's going out and not helping. And so you're kind of going up and down. It helps smooth all of that out. In general, deep brain stimulation is approved for people who've had Parkinson's at least 4 years. And then again, have these symptoms where we think that the constant electrical stimulation could really decrease. You're bringing up an important point, which is that it's really different for different people. So there's no, like, at 5 years, we have to start thinking about it and start talking about it. Or at 10 years, we've missed the window. We're really looking for that window, which is different in every single person, which is where, again, we've got these symptoms, and maybe you're taking a lot of medication, or you have a lot of complications of dyskinesia or the wearing off or things like that. And we think that by giving deep brain stimulation, we could really get a better effect on the symptoms, or we could really decrease the amount of medication that you take, and it could improve your life. At the end of the day, deep brain stimulation is an optional procedure. Nobody has to get it for any reason. But for a lot of people, it is this real in-depth discussion about if and when and how do I know if it's right for me. So you're doing the right things with talking to your doctor. There's also, we have resources on this as well to learn a little bit more. A lot of people find helpful to talk with other people in the community who've had it or not had it, and when they thought about it and what kind of prompted them. And then the last thing I'll say is, if you're interested in it, it's never, or I shouldn't even say if you're interested in it, if you're curious about it, it's never too early to learn about it and to just get more information so you understand what your treatment options are. And then if you are a little bit more interested in it, maybe considering starting to go through the process. It's a really in-depth process to evaluate somebody for deep brain stimulation, because we want to make sure that a person's going to have the best outcome possible. So there are a lot of tests and appointments and things like that to go through. And so sometimes it's kind of starting that process, which helps you understand, do I want to continue going forth with this, or do I want to kind of keep that on the back burner for now? I hope that helps.
Rachel, I know in conjunction with deep brain stimulation, a lot of times folks ask about focused ultrasound. Do you want to talk a little bit about that?
Yeah, who's heard about focused ultrasound? Yeah, okay, a handful of people. So focused ultrasound is a newer tool that's also a surgical procedure for Parkinson's, but it works in the same parts of the brain, but in a different way. So essentially what focused ultrasound is doing, instead of putting wires in and having all this programming and things like that, we're concentrating high intensity beams of ultrasound into an area of the brain to actually destroy a very tiny area that's responsible for movement symptoms. So it's kind of like taking a magnifying glass and concentrating sun rays down onto a leaf and burning a little hole in it. It's that same idea. So focused ultrasound is approved in many similar ways to treat the movement symptoms of Parkinson's, and especially that dyskinesia or the complications that can happen. But right now, focused ultrasound is only approved to be done on one side of the brain. And that's because if we do it on both sides in those areas, it potentially causes too many side effects. So we can only do it on one side, which means it may be good for some people. More treatment options is always better, because not every treatment is going to work for every person. So it may be good for people who say, have a really bad tremor just on one side and I really want to control that now, or I really just do not want deep brain stimulation because I don't want wires in my brain, or I really don't want that programming. And the challenges with focused ultrasound are, one, it's a little bit newer, so we don't really have that long-term data on it like we have with deep brain stimulation, which has been approved since the 1990s. It also is irreversible. So once we make that, once we make that spot in the brain, we can't undo it. Whereas with deep brain stimulation, we always say that's beneficial because it's technically reversible. We can turn it off, or we can take the system out, and we can also modify it. We can make adjustments, which is what we do with our programming, and adjust the electrical stimulation.
Thank you.
Okay, I had one more question, I guess, on the deep brain stimulation. You mentioned that a few minutes ago on the 4 new treatments. And the last one was that there were some new things on the DBS. Could you talk a little bit about that?
Yeah, always a popular topic with deep brain stimulation. So yes, the most recent approval is something called adaptive DBS, which is essentially a self-regulating system. So the way that deep brain stimulation works in the majority of people, and up until this new approval, is that we program it, we set electrical settings, and those are on all the time. And so they're constantly putting this stimulation into the brain to decrease symptoms. So they don't adjust in real time. If maybe you're feeling good and you don't need as much stimulation, or you took your medicine and maybe you don't need as much stimulation, it's really on all the time. What the newest system, and I'll caveat this with, it's a huge step forward in that we've been working on this kind of adaptive self-regulating system for over 10 years. So it is a huge step forward, but there's a lot now that we will have to learn about it. But essentially what the adaptive system does is, through those wires that we put in, it's able to recognize and monitor your individual brain signals and then deliver stimulation in response to those and adjust stimulation in response to those. So just like I kept saying, we program the settings, we still program settings and we program them within a window to say, don't let it go below here, don't let it go above here. But then it can adjust itself when it says, oh, you took some medicine, and maybe I can pull the stimulation down a little bit now because you're not having as many symptoms. Or, oh, it looks like you're off and your medicine's worn off. Now we need to push the stimulation back up again within that window that we set. So this is, as I said, a big advancement forward, but it's another incremental step forward, and we'll continue to see, innovation and improvement even upon this.
Thank you. You also mentioned, real quick, I think the window of time that is beneficial to you. My neurologist keeps saying that, at a certain point, it no longer helps you age-wise.
Yeah, so most doctors won't give a specific age cutoff. In the UK, they do. I think they say over 70, they won't do the procedure or something like that. Most centers in the US, we don't have a strict age cutoff, because there are some people who are 80 years old and they're as healthy as a 50-year-old, and vice versa. So there's not as so much of a strict age cutoff as there are symptoms that we look for, and we don't want to get past that point. So if somebody has really significant memory and thinking changes, or somebody has really significant walking and balance problems, we know that deep brain stimulation is not going to help those and may actually make them worse or may decrease the benefit that we would otherwise see and expect with deep brain stimulation. So we're really, when we talk about a window, we're looking at, do we have enough of these complications and side effects that we can modify, but we haven't gotten to, more significant memory, thinking, swallowing, balance problems that we know would make it less effective.
Thank you.
Okay, unfortunately, we are out of time. TCU is going to want this room after this. But if they want to ask follow-up questions in some way, how could they contact you or Michael J. Fox?
Oh, sorry. Feel free to come up to me afterwards. I do have some business cards, just that way it's easy. I don't have to spell out my email address for you. But if you call our main line on our website and you ask for Danielle Becta, they will get you to me, and I promise we'll get you answers to your questions. So feel free to come say hi afterwards.
And I want to thank our speakers once again, Dr. Dolhun, Danielle, and you. Thank you to the Zoota family for making this possible. And thanks everybody for coming out. Now, for those who registered, can I share your PDF with them?
Oh, absolutely.
Okay, so if you registered, I have your email. If you can get my messages, I will send this PDF to everybody. We are recording this in a few weeks or so. We'll put it on the website with the other lectures so that anybody can access it. Thanks again, everybody. We appreciate you.
Thank you.